Hello everyone. Once again, you're welcome to MR's OG3 Made Easy. So this is the second. This is the oncology module. I'm starting with the now explaining you the second case, that is a carcinoma cervix, and she's planning pregnancy. This is very important because you nowadays they're asking this. Usually they ask advanced stage. Advanced stage is very easy, chemoradiation. But she's planning pregnancy. You have to conserve the uterus, so it is very important, and pregnancy care also. So I'm going to explain to you, and it is length. I may take time to explain to you. It may not be in 10 minutes. But even endometrial hyperplasia also, it is not 10 minutes. But this is to give you a broad idea so that you can practice, and whatever you remember in the exam, you can present. So you have to practice to cover all the important points and present. So I am going to give you a brief outline of the case. So now here you are an ST5 covering the gynecology clinic today. You are about to see Mrs. Lisa Jacob, 32 years, and who want to plan pregnancy. Her BMI is 26. She has undergone LETS procedure and has come to discuss her report. Her reports are enclosed. You confirm Mrs. Name, age, and NHS number always. Please don't ignore this. Mrs. Lisa Jacob, 32 years, NHS. Pap smear, severe dyskaryosis. Let's done biopsy report. Gross 1.5 to 0.5 centimeters with clear margin, because it should be for one staging you need to know. For 1B1 it should be less than 2 centimeters. Microscopy, squamous cell carcinoma with 5 millimeter depth of stromal invasion. MRA, no evidence of spread of the disease. So the diagnosis is given as carcinoma stage 1B1. Now post LETS they have done a speculum finding also. That findings also given, no growth. So cervix is clear. Now this is the case in front of you. Here the BMI is normal. In endometrial carcinoma, it is BMI will be high. In cervical cancer, it is BMI will be normal usually. Younger age, they will be young age cancer cervix. Always they are young, more towards younger side. Now, with this case scenario in front of you, I'm going to start. Hello. This is the introduction. Hello, I'm Dr. Manjula, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? I'm Mrs. Lisa Jacob, and 32 doctor. How may I address you? Lisa, Dr. Lisa. So now agenda. I can see that you have undergone a small procedure called LETS a couple of weeks before, and you have done a special imaging also, that is called MRA. So you are here to discuss about them. Am I correct? Yes, doctor. Do you have any idea about them? About these reports? Yes, doctor, because they called me. I got a telephone call. They called me and told me about this report, and the tissue biopsy report, and they asked me to come and meet the consultant doctor. So that's why I came here, doctor. I know it. So now, then that means you know that she knows. That's very important. Huh? So now they asked me to come to undergo an MRI report, MRI doctors, but that special imaging they told me. And so they have done it, and I'm here with the report, doctor. Yes. And so I'm really worried, doctor. I'm planning pregnancy also. So then you say, be empathetic. I'm sorry to see you in such a difficult situation. Bring down the tone, and we are here to help and support you. I shall explain your reports. I shall list all the reports, Lisa, and also give you the management plan, including your pregnancy plan. Uh, okay, then will that be fine? Yes, doctor. But before we proceed, can I get few details from you about your condition, which helps in our management plan? Yes, doctor. Can you tell me why the tissue biopsy was done? As I am seeing you for the first time, can you tell me why the tissue biopsy was done? Always you need to know why it was done. Then you say, doctor, I had some unusual vaginal bleeding. So I consulted my GP, and then he took a pap smear that came as the report came as abnormal. So he referred me to the gynecologist. The gynecologist has advised me to undergo a small procedure. She told me that that abnormal area will be removed, and then that will be sent for testing under microscope. That is, she told me that that procedure is called something like LETS. She told me, doctor. Okay. The report has come. Then the report has come. They called me. To discuss about this reports, and also they told me to do an MRI also, doctor. So this is what has happened. So okay. Now, how far you know about your condition? I'm first. You say I'm very sorry. How is your recovery after the procedure? How is the recovery? How are you coping up with this your situation? Who is there to support you? These are brief things. Huh? So this is about, she will say, because always any procedure, ask recovery. Any procedure, ask recovery and support. So how far you know about your condition? Lisa, because we need to know how much she knows about this condition. So then she say, she will tell you, doctor, they told me that I have cancer, of the cancer of the neck of the womb, but they told me it is limited to that area only. It has not gone outside that neck of the womb. And so to know that about it, they asked me to undergo one special imaging, that is MRI. And that MRI report has come, doctor. Now I need to know what it is. Yes, okay. Now, can you tell me about more about you? How it started, this irregular bleeding? So she will say about her irregular bleeding. Now history of present illness. Now you have to go into the history of present illness. Doctor, I started having unusual bleeding since 4 to 5 months. And how is the flow? So doctor, it is a moderate flow. And is it related to the periods? No, doctor, it is not related. It comes on and off, and in between periods also. Like it irregular, it comes and goes, doctor. And how many days it lasts? It will last about 1 or 2 days, doctor. And how about before fit five, this problem started? How were your cycles before? They were regular, doctor. Now, any pain? Do you have any pain along with the bleeding? Some discomfort, doctor. Some discomfort is there in my lower tummy, that is between my hips actually, and that also is since couple of months, doctor. Then any discharge with smell? Yes, doctor, I have some discharge from since couple of weeks I'm having. Do you have any loss of weight or loss of appetite? Because always any cancer patient we need to ask loss of weight, loss of appetite. And also any issue with your waterworks or back passages? So this is about the history. Now you ask about the sexual history. It is very important. So can I ask a few personal questions? Yes, doctor. We always signpost. Can you, then you say, since how long you are in this relationship? Because you know that she is planning pregnancy. Definitely, so you just want to know. Otherwise, because she's planning pregnancy. So otherwise, you can say, are you in relationship now? Yes, doctor. Since how long are you in this relationship? She'll say some 2, 3 years or something. Then you say, since how long you're planning pregnancy? She will say doctor, I'm planning since 6 months, doctor. So are you so because now already you took the signpost, you did the signposting. You say, do you face any difficulties during your sexual activity? You or your partner? Do you have any pain or any bleeding after the sexual intercourse? That is, you want to rule out dyspareunia and postcoital bleeding. And your partner, does he has any problem of erection or any ejaculation, any problem? Can you tell me how frequently you have the intercourse? She'll say 3 times a week, doctor. So normally, anytime you or your partner had any infections, that is sexual shared infection, like anytime you had fever or pain in the tummy or a small some discharge, she will say no, doctor. Or any partner had a problem anytime, is he fit and well? Yes, no problem, doctor. Suppose she says yes, then treatment. Now, treatment, what type of treatment? So, then any pregnancies? So now you want to know any pregnancies? Have you taken any treatment to become pregnant? She said no. That also you have to ask. And now, have you had any pregnancies before? So no, doctor. Then coming to the gynec history, when was your last period? Always LMP. When was your last period? Doctor, 2 weeks before. Can you tell me about your cervical screening? Were you regular with your cervical screening? Because now we know that recent one is dyskaryosis. Were you regular? She said, no, doctor, I was not regular with my cervical screening. I missed my 2 appointments. And the recent one which I have done, then that shows abnormality, doctor. Some abnormal thing is there. Yes. So any contrast, I'll explain to you about it in a while. Lisa, have you used any contraception before? Have you taken any HPV vaccination? Vaccination for an infection caused by virus, that's called HPV vaccination? Yes or no, she will say. Sometimes you will say, usually she'll say no. Then then you have asked about the previous pregnancies. Then coming to the, suppose she says previous pregnancy, suppose she says no, that is over. If she says yes, as usual, ask about the gestation age, whether the scan was done, heartbeat was there, how it was managed, medically, surgically, or expectant. Now, do you have any, are you taking any long-term medication that is for any increase in the blood pressure or sugar? Any clot? Any allergies? Do you have any allergies? Can you tell me your blood group? Do you have an idea about it? Because we are planning surgery for her. Any surgeries in the past? Have you undergone any operation in the past other than this procedure which you have undergone now? Any family stuff, any concern? Because here usually family history of cancers will not be there in cancer cervix. Do you smoke? Take alcohol? Pardon me for asking, drugs, all these things. I see that your BMI is normal. And what do you do for living? How is the support at home? And because now that she knows about this condition, how do you feel after knowing this result? Do you feel you need some counseling or any support from us? We can arrange for you, Lisa. Okay. She said yes or no. Then, would you like to add anything? So this is the end of the information gathering. Examination findings are already there, so you need not do the examination. Now, discussion, coming to the discussion. So now, Lisa, now because there's no need of BBN, breaking bad news, because she knows this condition. So no need. So now, Lisa, let me, now that you know your condition, the doctors has told you about your condition. Now, and you have an idea about it, and so I will explain you how to proceed from here. The management I will explain to you, and yeah, as you're planning pregnancy also, I will tell about pregnancy care also once you become pregnant. Will that be fine? Yes, doctor. Now, coming to the reports, let me explain to you the reports first. Then, I have confirmed the name, age, and NHS number on the report, which is reports which are provided to me. See, this is the biopsy, tissue biopsy report. That is, I shall draw and show you. See, this is the womb. This is the neck of the womb. So, this growth, it was around 1.5 centimeter around with clear margins. That's limited to that area, to the neck of the womb only. You are drawing and showing. And when they examine under microscope, they examine, it was showing some little bit of growth inside, going down. It is spreading into the for around 5 millimeter. So this is but limited to the neck of the womb. And second thing is the MRI, the special imaging technique, also shows that the growth is not spread to beyond the neck of the womb. So this stage is called stage, stage 1B1. We call in medical terms stage 1B1. So then and after the procedure also, they have done an examination for you, and they say that that area where the operation was done, it is clear, healthy. At present, it is clear. So there is no problem. So now let me explain to you about your treatment, further treatment from here. Let me take you forwards from here. Doctor, are you going to remove my womb? Because I want to plant children. No, Lisa, no. We have options for you. I'm going to give the options. And also, we have a team of doctors that is called a multidisciplinary team, where our consultant, our cancer specialist, and the tissue doctor, the Macmillan nurse, and the counselor, all people are involved in your care. So then, coming to the options, we need to do an operation for you, because for this case. But usually, what we do, we remove the womb along with some notes, and sometimes we give high energy. Sometimes we give high energy beam also to that area, and sometimes we may give cancer. I mean, injections to kill the cancer cells. But in your case, as you're planning pregnancy, we have a second option, that is called that is removal of the neck of the womb. That is called radical trachelectomy, where in the medical terms we call it as trachelectomy, where we remove the neck of the womb, the tissues around that neck of the womb, and also the upper part of the vagina. See, like this portion we are going to remove, and we are going to join the lower part of the womb to the upper part, the vagina which is remaining. So like that, you're going to draw and show. And we put a stitch, permanent stitch at this area where we join, we put a permanent stitch. So you're showing the diagram. Then before this procedure, what we do some blood tests to know your blood strength, to know kidney function, liver function, and also we take an X-ray chest of the chest, and also we do kidney test also. We inject a dye and take an X-ray that is called intravenous urogram. So to know whether there is any spread, we know to stage where you are. So these things we do, and then we will go ahead with the surgery. Am I clear so far? So now, yes, doctor, can you tell me more about surgery? Yes. So we do the surgery. That is, we remove the neck of the womb. We do it under the sleep medication. Then it can be done. It can be done by keyhole or an open cut. It can be done also from down below. And then, but the benefits, what the benefits are, that is, your cancer containing area will be removed totally. And the risk, what are the risks? Risk are there for the operation, any operation, like you can have bleed, there can be bleeding, there can be infection, there can be injury to other surrounding areas, bladder and those areas, and also there can be need for blood transfusion if there is any increase in the bleeding. Sometimes there can be pain, and also, so then sometimes after this operation also there can be some issues, bladder issues with the bladder, that's water works, or there can be clot in the leg. So these are the few complications or issues that can come after with the surgery. And there can be some issues with the anesthesia also, the sleep medication also. So am I clear? Yes, doctor. But we need to balance, Lisa, the risk and benefits of everything. And so now coming to the doctor, then what about pregnancy? Tell me, after this operation, will I able to have a baby? Yes, I'm going to tell about that. So after this operation, you need to plan pregnancy only after 6 months, not before that. But till then, you use some pills, that hormone pills. You can use some hormone pills, that's called contraception. That is, you can use even both estrogen containing and progesterone. The hormones estrogen and progesterone can be used, combined pills we say. It can be used as a pill, it can be used as a implant. We put it under the skin, implant, or we can put as a coil, hormone coil, that is progesterone coil. But that may be difficult after this procedure. The best thing is, there is only one hormone. You can take both hormones, but the best is taking only one hormone, that is called progesterone hormone. So these you can take, and for 6 months, but the progesterone hormone, progesterone only hormone is the best. So now after that, you can plan pregnancy. Doctor, can I become pregnant naturally? Yes, you can become naturally, but you may take some time. So we will refer you to the fertility specialist who will help you and help you in achieving your pregnancy. Either they will go tell you to become pregnant as early as possible, because this disease can come back. So you need to become pregnant as early as possible. So they'll explain to you about the test tube baby, that is advanced reproductive technique. They will explain to you where the chance of pregnancy are very high. They're very high. That is the 60, around 6 out of 10 can become pregnant. So it's very high. So am I clear so far? Lisa, yes, doctor. But Lisa, there can be issues with when you become pregnant. There can be some issues also. Can I explain to you? Yes, doctor. Yeah, I want to know also. So there can be some issues because the neck of the womb is removed for the mother and the baby. There can be miscarriages. That is in the first 3 months, or in the middle 3 months. That is first half of the pregnancy. There can be miscarriages. And also the second thing that can happen is baby can come out early. Sometimes it can happen. The third thing is the water can break much before the delivery date. But much before that, the water can break. There can be infection coming, going up into the womb. And so that also can happen. And so then sometimes what happen, they can be, suppose you go into labor by yourself, then the wound can break. That is, the wound can rupture. That is, and sometimes there can be severe bleeding. So, but our team, what to do, doctor, then? But our team of doctors are there who will take care of you. So because of this, your pregnancy is a high risk pregnancy. Let me tell you about the pregnancy care. Can I proceed? Yes, doctor. So you will be under consultant-led care, under team of doctors. That is our consultant, imaging doctor, baby doctor, cancer doctor, and counselor, midwives. And you need to come frequently. You need to come for frequent visits. You will be doing a booking blood test, and then also will be put on vitamins. And then we will do a scan, dating scan, that is to know dating scan. After that, we will do the scan to check whether the baby has any abnormalities, that is genetic problems. And also we will do from mid-pregnancy scan to know whether baby has any abnormality. Then after that, we will do also check whether we do frequent scans. That's why we need to do frequent scans. Why? Because the chance of baby coming out early is there. What we do, we will check do the scan to check whether the lower part of the womb is opening up. So that we do every 2 weeks. Am I clear so far? Yes, doctor. So you can draw and show also. Every visit, whenever you come, every visit, we check for infection. Because of the stitch is there, then we check for infection. And also we check from down below to check whether any discharge. If there is any discharge, we'll send it for testing. And also we will send urine also, because to rule out any infection. If there is any infection, then we will give the antibiotics. So usually first test will be done at the first visit. Am I clear? Yeah. Then the second thing is we need to put you on, give you some hormones. That's called hormone tablet. That's called progesterone. You need to put from down below, inserted down below. That's called pessary. From 12th week, you have to use until 36 weeks. Okay. Okay, Lisa. Then coming to the other thing, you need to limit your activity. From second half of pregnancy, you need to limit your activity, but doesn't mean that you need to take bed rest. You can do your normal, moderate activity. The other thing which I want to tell you is avoid sexual activity from mid-pregnancy. And also, don't undergo, we advise you not to undergo any dental procedures regarding connected to the teeth, your teeth. So then, the other thing which I want to tell you, Lisa, you need to wear some stockings. If there are any risk factors, the doctor will tell you whether if you have any risk factors, he will advise you to wear stockings and start on blood thinners. Am I clear so far? Yes. Doctor, will I have normal delivery? Can I have normal delivery? Yes, I'm going to discuss about that. Your delivery will be discussed around 36 weeks, the mode of delivery, and also the type of anesthesia to be given will be discussed by your doctor, consultant doctor, obstetrician, and also the anesthesia sleep doctor. So usually we will not advise to go you into labor by yourself, because I told you that if you go yourself into labor, then the risk of womb opening up, rupturing, that's called rupturing, is there, and severe bleeding will be there. So to avoid that, we do cesarean section. We fix a date, that's called planned cesarean section. We fix a date around 37 weeks to avoid these problems and do the cesarean section, especially because there is a stitch. That is why. So now after the delivery, you will, can feed your baby normally, and then you will be under blood thinners. The doctor will decide whether the blood thinners will be put or not. Then second thing is, important thing is follow up. You will be under care of your cancer doctor. So after 6 months, you have to visit him. They will take a smear, and then after 6 months, then 12 months and 24 months, they will do the smear. So to check whether everything is fine. And also they may advise to a special imaging technique after 1 year. This is very important. This is what about the follow-up. Am I clear so far, Lisa? So now, yes, doctor. Do you have any other concern? Yes, no, doctor. No. So what I need to do, doctor, now? Yeah, I will document whatever we have discussed. This is the information leaflet, written information. You can go through it. This is about the condition, what we have discussed. Then I'll connect you to the support group who are facing the similar problem. You can discuss with them also. And I'll give an appointment. Now, I'll give an appointment with my consultant. So you discuss with your partner, come down, and once you decide, you tell our consultant. So with your informed consent, so once you decide and give us the consent, informed consent, we will proceed. We'll give a date and proceed with the surgery. That's operation. That is removal of the neck of the womb. That's a trachelectomy. So if you need, we will give an appointment with our counselor also. So am I clear so far? Any other concern? No, doctor, everything is clear. So, okay, then Lisa, thank you for discussing with me, and see you then.